Please welcome Dr. John Martin, Chief Medical Officer of the Butterfly Network, and Kathleen Koch, author and journalist, for a sponsor perspective presented by the Butterfly Network.
IQ, that looked fascinating. I understand it is the world's first and only semiconductor-based handheld ultrasound technology you can use on the entire body, and you used it yourself to find your own cancer. Tell us about it and how it works.
You know, it was a great experience. Not sure I was signing up to be patient number one when I joined this job, but I got a chance to see this incredible device, to walk out on stage, pull out of my pocket an entire ultrasound system. It's a phenomenal device that's transforming the way we practice medicine. If you think about the way the world has evolved, when you can put things on a silicon chip, it transforms technology.
So that just plugs right into your
smartphone. Exactly
Wow.
right. All other ultrasound systems require multiple probes to scan the different parts of the body. This is the only one that's on a silicon chip that can scan the entire body for a little over $2,000, and it fits in your pocket.
How is that impacting care delivery and across what settings? Because I understand that it's evolved beyond what's possible with not only traditional ultrasound, but other point-of-care imaging solutions.
You know, I learned this firsthand through my own experience, and we've all been through a place where we have a history and a physical when we go see a physician, and no matter what the venue, it's that, and then we pause. Do I know enough at that point to make a decision on what's wrong with you and what treatment do you need, or do I need more tests? And we all know more often than not, you need more tests. And so that's either waiting for those or being sent off for those, and that's a destination. With Butterfly now, it's history, physical, image. And now I've got the right information to make better decisions, more efficient decisions, and send me on my way of getting better. And it's just transforming the way we practice medicine, no matter what the care venue, no matter what the illness or stage of disease or stage of life. Butterfly can be an effective tool to change the way healthcare is delivered.
So that's really compressed the time period. And for patients, that's so important because you hate lingering in limbo, you know, when you're waiting for test results.
What's wrong with me and when can I get better?
Right.
This changes that.
Let's talk about where it's really making a huge difference in some of the poorest rural areas of sub-Saharan Africa, and then also in war-torn countries like Yemen and Ukraine. Talk to us about the difference that it's making there.
So the importance of having a device that is not just the device, it's the user interface, your smartphone. We all know how to use smartphones. And it's the workflow, how do you transmit that information? And now it becomes so portable, it can go anywhere. So in the poorest countries of the world, 2/3 of the world has no access to medical imaging at all. Now it does. And then you couple with that artificial intelligence tools to make it easier to use, to make it easier to transmit that information, easier to interpret. Now we deal with that issue of health inequities that we spoke so much about today, so that everyone can have access to the same technology. Where in the poorest regions of sub-Saharan Africa, on the front lines of the battlefield, in Ukraine where people are injured, and imaging, that imaging information plays such an important role. About 80% of the time, when we don't know what's wrong with you, it's simple imaging that answers that question. Now we can answer it right away with Butterfly in the pocket of all of these physicians.
What about training? Is there a big learning curve before anyone can use this?
So part of what Butterfly is trying to do is accelerate that. Yes, you need to be an expert, but we're also on that journey to the home. We've started clinical studies with patients actually scanning themselves. And as you build that intelligence and expertise into the device, we'll make it easier and easier to unleash the full power of ultrasound imaging information to make decisions. So yes, there's training, there's ways in which we're addressing those, and we're being very smart and working with the FDA to making sure it's safe and effective in the journey that we're taking.
We're talking about equity, global healthcare equity here today. So is this really a game changer when it comes to that?
You know, if you think about it, when we're expecting a child here in the United States, we're wondering, is it a boy or a girl? And what am I going to name the baby? In the developing world, they're wondering, are they going to be alive to see their baby grow up? This changes that. Fundamentally, we just developed an application with the Gates Foundation and University of North Carolina, where a blind sweep across the abdomen done by novices could then take that information and spit out gestational age as well as an expert can do it. And we're now deploying 1,000 probes into sub-Saharan Africa to change the lives of those people over there. This is transforming the way healthcare is being provided, whether in the most advanced institutions in the country, the most remote regions of the world, up in the space station, on the front lines of the battlefield, on the sidelines of sporting events, on the ambulance that takes you to the hospital, you name it, Butterfly is there.
Share some stories.
So I think my own is a pretty impactful story because it becomes personal. And once you, as a practicing physician, I'm a vascular surgeon, you get on the other side of the knife, you begin to appreciate the impact of time. And a little bit of a lump, I was ignoring it as most doctors do, but I imaged it, I saw this, I sent it right to my doctor, instantly said, you got a problem, let's go. And I started on my treatment, and I'm probably sitting here today because of this device. And there are many more. A physician's father came over to his house for his son's birthday, was feeling a little uncomfortable, was an emergency room physician. He took out the device, had his father lay down, saw an abnormality on the cardiac scan, zipped him to the hospital, and he ended up having a procedure to save their life. And I could go on and on and on. The importance of time, we don't think about that. Our offices and hospitals are full of waiting rooms. We're called patients. Time is such this co-pilot in healthcare that we don't really think about, but it's our enemy. The longer we wait to get the diagnosis, the longer it takes to get better.
You know, it's been our
Butterfly
enemy so
conquers
much
that.
during the pandemic. Did this come into play during the pandemic?
Huge, and I think one of the things that we learned through the pandemic is the power of imaging information for lung assessment. Actually, we've known for a long time that lung ultrasound's better than a chest X-ray.
Really?
And so as early as in Italy, when all of this first started, butterflies were deployed because so easy to clean, not a big X-ray machine that you have to clean, and you could actually scan the lungs and the heart. You could also deploy them in tents, and we used it to assess patients on the severity of the COVID to decide who needed to be admitted and who didn't. We also did studies in Italy where patients were monitored at home, which is the place we all want to be. And so it was really important, and it's accelerated now because some of the same findings in COVID we see with congestive heart failure, and in important trials we're starting now with managing congestive heart failure the same way out of the hospital, lowering the cost of care and improving everyone's life.
When it comes to maternal health, our numbers here in the United States are very poor compared to other industrialized countries. How are you seeing it begin to make a difference there?
Well, I think part of the inequities of care is the inequity of availability of powerful tools that provide imaging information that's so important to our decisions. And so hospitals have to make an institution decision on where do I spend our money. Now, all of a sudden, if a complete imaging device is available for $2,300, the access to available information becomes different. And so we're going to see that play out in rural America in a very big way, and we started that already with many of our institutions. So whether you live in the most remote regions of the United States, you'll have access to the same imaging information that if you went to a high-end academic institution to answer important questions. Not all of them, but many of them that make a decision about whether I can stay home or come to the hospital.
So how widely used is that currently?
Tens of thousands of these are scattered across the United States and across the world. We're in 31 different countries, medical schools across the country, almost every one of the top 100 hospitals. It's creeping in. And most importantly, it's now become core to medical school education. So we've got medical schools across the country that when they have their white coat ceremony, welcome to medical school, here's your butterfly. And they're learning how to make imaging and that imaging information to be a powerful part of the initial decision making as we take care of patients.
Thank you so much. Dr. John Martin, Chief Medical Officer for the Butterfly Network.
Thank you very much.